Obesity rates for children with disabilities are 38% higher than for children without disabilities, according to the National Health and Nutrition Examination Survey. Yet children with disabilities are too often left out of the childhood obesity conversation. To address this inequity, KEEN, Kids Enjoy Exercise Now, recently held a summit meeting in Washington, D.C. Titled, Mom, I Want to Play, the symposium featured expert speakers and panelists who discussed the need for, availability of, and obstacles to providing fitness programs for this population.
I would like to introduce to you the founder of KEEN and my very, very good friend, Elliott Portnoy.
Often she says mouthy and rude. So good morning and welcome. My name is Elliott Portnoy, and it is an enormous pleasure to welcome you here as the founder of KEEN, but also the global CEO of Dentons. Dentons is a law firm, actually now the largest law firm in the world, but today I take off the CEO hat and get to talk about something that is far more important to me, and I know to all of you. So I have some thoughts I want to share. I actually have the easy job today, which is to tell you a little bit about KEEN, but also to tell you why we're so excited that we're all together for this. We're really deeply appreciative that all of you and the organizations with which you're affiliated have allowed you to be here today for this inaugural symposium, which we hope helps foster some new relationships, brings about some enhanced partnerships, and ultimately some great collaboration so that we can achieve some progress towards the aspirations that all of us share, ambitions we all share, which is to improve opportunities for young people with disabilities to have access to sports and recreation and exercise. So let me tell you a little bit about KEEN. I'll give you the quick version and then we'll show you a little bit about it. We've got a good backdrop here. I actually haven't seen these. That's when my hair was a different color than it is today. But KEEN, as you will by now have figured out, is a recreation program for young people with disabilities. It was founded in Oxford, England in 1987, which started as a small tennis coaching program for young people with disabilities that a couple of friends and I created when we were studying at Oxford University. In time, this little tennis coaching program became KEEN, Kids Enjoy Exercise Now. The English are very fond of saying, I'm keen to do this, keen to do that. I'd like to tell you it was a very complicated naming exercise with branding consultants, but we simply recognized that everyone was keen to do this, and so we came up with an acronym that appropriately captured what we did. So KEEN, that little tennis coaching program, quickly grew into what is now the largest program of its kind in England, with multiple programs in multiple cities that continue to thrive today, nearly 30 years later. The hallmark of KEEN then, as it is now, is a very simple idea. We match trained volunteers, typically volunteers who have never spent any time with any person with a disability in their lives, and we match them with young people with disabilities to experience sports and just to have fun. At all our activities, every athlete has at least one volunteer with them at all times, and from the beginning, and now 30 years later, all of our activities have always been offered completely free of charge to the athletes and their families. Something about which we're very proud. But fast forwarding on this side of the Atlantic, KEEN was launched in the Washington, D.C. area by a number of people who happen to be here in the room today with me in 1992. Just like the program in the United Kingdom, KEEN in the U.S. specializes in serving young people generally with more profound disabilities, those with more significant needs, typically those who have never before had access to any organized recreation activities, either through their schools or their churches or synagogue or local youth groups. In these 30 years, we've never imposed any limits on the kinds of disabilities of the athletes who come to KEEN. We're inclusive to all. Today, KEEN has over 24 programs right here in the Washington, D.C. DC area. We have the Keene Greater DC Executive Director and a Senior Program Director here. And those 24 programs are not only literally within eyesight, if you can knock down that wall, here in the District of Columbia, but active programs in Northern Virginia, a thriving and robust set of programs in that important community, and in Maryland, where we're not only in the close-in suburbs, but Keene Greater DC extends all the way out to Baltimore. But in addition to the great work that we do here in our kind of home community of Washington, D.C., we're delighted that we have Keene affiliates, which are represented here today, that are doing amazing work in 6 cities around the U.S. Chicago, L.A., New York, Phoenix, San Francisco, and St. Louis. Great work all around the country. When we launched Keene 30 years ago, there was no such thing as the epidemic of childhood obesity, or if there is, we certainly didn't know about it. There was no national attention or worldwide attention to the public health dimensions of the crisis. There was no research that showed, as it does today, that youth with disabilities have obesity rates that are more than double that of their typical peers, leading to expensive and quite profound health complications later in life. Today, research shows that families of children with disabilities report that 40% of these young people have no access to any organized exercise or recreation activities. Nothing like Keene, no inclusive or adaptive programs in their communities. We didn't know that 30 years ago, that there would be quite literally a public health crisis that affects young people with disabilities and their families. But we did know then that an inclusive and pretty unorthodox approach to how we provide services to young people with disabilities might change their lives. Then as now, we focus on providing those recreation opportunities in a non-competitive and completely inclusive environment. Through exercise, our Keene athletes build relationships, self-esteem, and skills, and the kind of environment out in the community that many of their families thought didn't exist for them, all while giving parents a much-needed break, some respite on weekends when Keene activities take place. We're also enormously proud that, that among the many benefits that Keene has provided over these 30 years is one that many organizations like ours don't always talk about, which is actually the volunteer dimension. Many of our volunteers had their first exposure to people with disabilities at Keene, and we are hugely proud, huge might not be a large enough descriptor, that in the 30 years since we launched Keene, over 35,000 volunteers have gone through the Keene training process and spent time with Keene athletes. Some of those 35,000 came once, and that's fine. Some have been coming for not quite 35 years. I think we've got a volunteer who's at 23 years, which is pretty darn good. But whether it came once or for all these 23 years, Beth was 7 when she started, the reality is that when they meet someone with a disability in the workplace, when they encounter someone with a disability in the mall, the park, they have a different view about the interests, the potential of those people in our community, rather than a focus on disability and limitations. And that's something we're hugely proud of. It's a very exciting time for Keene at the moment. Our very simple idea, it really is simple, has taken root across the nation and is flourishing in some ways that we never expected 30 years ago when we started on this journey. Certainly not when we started tossing tennis balls to kids with disabilities in Oxford. But that very simple idea has taken hold, and that's kind of what we hope happens with this symposium, because ultimately it's a pretty simple idea. We want to bring people together to share best practices, to talk about lessons learned, maybe to share some resources, and talk about some mistakes that we've made. And that simple idea is what we hope will pervade the conversation we have today. Ultimately, we recognize that for decades, Keene has provided services, trained volunteers, and changed lives. But we've done a lot of that principally in isolation, and we hope that today marks the beginning of a different phase in our development, where rather than just continuing to do what we've always done, and we're very proud of what we've done, and we do it very well, that we instead can start communicating and collaborating far better with organizations like yours that in some cases are very similar in their mission, but deliver services through different models, different partnerships, and different pathways. We very much hope that this simple idea of getting everyone together might cause Keen and maybe some other groups to start working together differently and better. I hope that together we can talk a little bit about how, with our shared and collaborative efforts, we can begin to focus more attention on the epidemic of childhood obesity, particularly within the disability community, and hope we can talk a little more about some of the challenges that we all face in providing better access to people with disabilities in the recreation and sports setting. We very much want to learn from your leadership and experience, and hope in turn we can find some innovative ways and develop some partnerships that will support all of our organizations, and in the end result in more attention, more funding, more resources, and more opportunities for people with disabilities to access sports.
For more than 2 decades, Keen has been providing free sports and fitness programs for kids with disabilities in Washington, D.C. and in locations across the country. For more information on the symposium or on Keen, please visit their website at www.keenusa.org.